putting together a national pharmacare program, if it was easy, I think that many governments would have done so in the past. If we look at the creation of the Medicare program 50 years ago or over 50 years ago, it was not done overnight.
The federal government can want universal pharmacare, even promise to pay for it, but it has to get the provinces, those who deliver health care, to go along with it. 1 out of every 5 Canadians has inadequate drug coverage. That's 7.5 million people. So fixing that pillar of a universal health care system would mean a lot to a lot of people, which is why this is also just good politics, if any party manages to do it.
This recommendation is over 40 years old.
Wow.
Canada needs single-payer pharmacare now. But while Canadians anxiously wait for help, Liberals and Conservatives put pharmaceuticals and insurance companies ahead of people.
Over the past 4 years, we have acted concretely on a broad range of measures to make lives easier for Canadians, not just the kind of wishful thinking that the NDP specializes in.
Part of that blunt attack is because the NDP recently promised a universal plan of its own, and to do it even faster within 2 years. The battle between the NDP and Liberals becomes less clear if the promise is similar, which may be why the Conservatives don't talk about universal coverage at all.
Studies show that is a small percentage of people who don't have access to provincial plans, who don't have access to employee-sponsored plans. So that would be where our focus would go.
Of course, none of this will happen until well after the next election, and Canadians will have to decide what plan suits them best. So Canada's prescription drug situation is a bit unusual. It is the only industrialized country that has universal health care without some form of universal drug coverage. But every country has hit on its own formula. The UK, for example, covers most or all of a drug's cost, while France's co-payments actually decrease based on the drug's proven medical benefit. New Zealand co-payments just $5 or less. And it manages to keep drug spending down by bulk buying a tightly controlled list of approved drugs. The trade-off, that can actually limit patient choice.